So what we'll do today is I'll just give you a brief overview about the Department of Health Management and Policy, and then we'll have some time for questions and answers. So to start off with, again, welcome everyone. Thanks for joining. And again, maybe I'll give you a little more introduction about who I am. I'm an associate professor in the department, associate chair of the department, and the chair of the admissions committee. Simona and Eben are also on the admissions committee. We're happy to talk to you about the admissions process and about the department itself. My area of research is in using mathematical models to look at health policy problems. I do a lot of cost effectiveness analysis research. And I'm also teaching a class on cost effectiveness analysis, and sometimes I teach some classes on healthcare operations as well. So our mission in the Department of Health Management and Policy is to cultivate exceptional leaders who create and apply knowledge to enhance the health of individuals and communities. And our vision here is to contribute through research, education, and innovation in designing and implementing an affordable system to improve health and transform healthcare worldwide. We have a lot of different values in our department. The first is integrity. We want to make sure that we have a lot of integrity, both in our academic areas here in the program, but also really when you graduate from the program, it's really important to have integrity. When you're in the world of either health policy or healthcare management, you have a lot of responsibility for a lot of people. There are a lot of and people's health, and it's important to have integrity when you're operating in that environment, especially. Excellence is another of our values. That's something that permeates the entirety of the University of Michigan, but it's very important for our department as well. Again, it's really important when you're managing health, when you're developing health policies, to have excellence. We want the very best. Next is, of course, learning. We are an educational institution, and of course, we value learning, and you as our potential students are a big part of that, part of our values. Then inclusiveness. Eben also already mentioned that he has a very specific research interest in diversity, equity, and inclusion. And our department, one of our important values is inclusiveness. And we want to make sure that everyone is both kind of from an educational perspective, but also when you go out into the world, we want you to be inclusive of a variety of all the people that you serve. Next is collaboration, and collaboration is really important, especially in health and health policy. We can't do any of this stuff alone. Oftentimes what we're doing is part of a team. And just as I think about myself, I have actually an educational background in kind of engineering and building mathematical models, but I don't know a whole lot about diseases. So I need to collaborate with physicians when I do my research. And when you go out into the world, you can't just solve the world's problems by yourself. You need to collaborate and work effectively in interdisciplinary teams. So that's an important value that we have. And then finally is equity. There are certainly a lot of inequity in our healthcare system and in our health policies, and we think that's an important goal that we should be striving for, is striving for equity, and so that's an important value that our department holds. You're all here because you're potentially interested in applying to the University of Michigan, so I want to kind of walk through at a high level what our admissions process looks like. So you're here at this kind of prospective student day. You're kind of learning about our department. You may choose to apply to our department. You'll apply through a system called SOPHUS. You kind of create an electronic application with personal statements, transcripts, letters of recommendation, all that good stuff. Then our department will review that, and some of the applications will be rejected at that point. But those of you who are here, you're certainly motivated to be part of our department. I would expect most of you would kind of go on in the process onto a process where we'll have an interview with you so that we can get better know you and understand a little more richness about who you are besides what we can read in the text of your application. That gives us a better sense of who you are, and also hopefully that gives you a better sense of what our department is. You're learning that today, but you're also learning about that in the interview. We also will have a virtual visit day for you to meet with our current students and some more of our faculty to get a sense of what our program is about. Then us and the admissions team will make an admissions decision, and then you'll make a decision about whether you decide you want to come to the University of Michigan. So this is a two-way process here. We're trying to find the best students for our program, and you are making a decision for yourself about what is the best fit for me, where's the right place for me to go, what's the best for me in my future and career. So to just point out a few things about the Department of Health Management Policy, some of the things that are unique about the University of Michigan's Department of Health Management Policy. First is we have a blend of management and policy. And that is one thing I think that truly makes Michigan unique from many other schools, is if you're interested in management, you'll of course get a lot of that. If you're interested in policy, you'll of course get a lot of that. But everyone will get a mix of the two. So if you want to be a hospital system CEO, you'll learn a lot about management, but you'll also learn about a little bit of policy. Same thing if you want to be a great health policy maker, health panel analyst, you want to head the CDC or FDA or something like that. That's great, but you'll also learn a little about healthcare management. Why is that important? Well, what we learn when we talk to our alums who are, let's say, hospital system CEOs, the things that keep them up late at night are not necessarily management issues. They're also worried about policy issues. Those are the things that really drive their environment. You know, if we get Medicare for all, that's going to be a big impact on how hospital systems have to operate. And so they need to understand that policy environment if they want to be successful. Similarly, if let's say you're the head of the FDA, great. You need to know how to manage your organization, first of all. So you need some management skills. And also, you need to understand how these organizations external to you are going to respond to your changes in policy. We have all kinds of examples of unintended consequences of health policies where things are very well intentioned, how we're going to create a really great policy, but because it doesn't take into account how managers are going to respond to that, how the external environment of hospitals, insurance companies, et cetera, are going to respond to that, that can have unintended consequences that might make things worse. So it's important as a health policymaker for you to also understand what's going on in the management world as well. Then the next unique aspect is really the leadership focused, comprehensive curriculum. Dr. Dotson here is really one of the leaders in our department who leads that leadership focus. But we also have some other folks who are part of that leadership curriculum, and we have alumni and guest speakers who come in who really give you some of that leadership experience. And I'll talk also a little about in a few slides about our comprehensive curriculum. Next is the access to the other schools at the University of Michigan. When you're a student in the Department of Health Management Policy, of course, you're one of our students, and a majority of the classes you'll take will be in our department, and we think they're great. But you do have access to other parts of the university. You can't necessarily take every single class you want across the university, but oftentimes many of our students' favorite electives are outside of the Department of Health Management Policy. There are great classes in the Ross School of Business or the Ford School of Public Policy or in social work or engineering that our students really enjoy. And it's nice when you're at the University of Michigan, you have access to really, really excellent excellence across the university, not just within our department, excellence within the School of Public Health, and again, across the university. The next one of the unique aspects is the Michigan Alumni Network and commitment to students. Just an hour and a half ago, Dr. Dotson and I were talking with some of our alums, and our alums really have incredible passion. I mean, they have an overabundance of passion for each other and for our department and for our students. And I have found that they're incredibly willing to devote time, and they're incredibly generous with their time when talking to students. They often serve as alumni mentors and guest speakers, and that's a really valuable resource. I think that they're always willing to talk to University of Michigan students and help them and give them some guidance about their careers. And when you're in a program like ours, you're here to advance your career. It's a professional degree program. And so it's really nice to be able to talk to people who have that career, who maybe are 5 or 10 years out, who are who can give you that early career advice about what to do. So that's, I think, a really valuable resource. Again, it's nice to get some advice from faculty members like myself and Dr. Singh and Dr. Dotson, but it's really great to get a lot of that career advice from someone who's actually following that career path that you're looking to be on. So in the end, it ends up with excellent career prospects, and we'll talk about that in a few minutes as well. So again, we're a mix of management and policy here. We have 2 different degrees that you can choose to get. You can choose to get the Masters of Health Services Administration, MHSA, or the Masters of Public Health, the MPH degree. The MPH degree is a little more focused on policy. The MHSA degree is a little more focused on management, but there is a blend of the 2. And if you get the MPH, you'll get some management. If you get the MHSA, you'll get a little bit of policy. You don't have to decide on day 1 which degree you want, although when you apply, you'll pick one or the other. So if you're not sure yet, that's okay. But within the first year, we'll want you to kind of sort things out and figure out which direction you're going to be going in. But you don't have to make that decision today. So the MHSA, again, is more focused on kind of organization, financing, marketing, and management of healthcare organizations, and the MPH is more focused on public health systems and things that influence population health. Our curriculum is focused on competencies. In the end, really, we're focused on health leadership, but you can think about kind of 3 big, broad areas for health leadership. The first at the top here is transformation. The next is execution, and then people. And there are a bunch of kind of sub-competencies here. I'm not going to read them all off for you, but it's important to have all of these things together. You can imagine you could be really great with people, but if you can't execute, you're not going to be successful. You can be really great at executing, but if you can't deal with people, you're not going to be successful. And then also you need this transformational vision as well. But again, you could have a transformational vision, but if you can't execute or work successfully with people, you're not going to be successful. So really, we're hoping that if you get all of these things, you'll be there at the center and have the skills you need to be a successful leader. Now, when we say be a successful leader, you're probably thinking to yourself, there are a lot of people on this Zoom session. Our class, might have 60, 70 students in it. How can everyone be a leader? Well, in the end, we're all leaders within our own sphere of influence. And that is how everyone can be a leader, is you are a leader in your own area or sphere of influence. So we can have a lot of leaders in our program, and a lot of people graduate and become leaders. There are a lot of opportunities out there, leadership positions for everyone. And again, everyone's going to develop their own specific area of expertise and be a leader in that own area of their sphere of influence. Next, I want to talk a little bit about the internship. This is a very important part of our program. There's a lot of academics that you're getting in the first year and the second year, but in the middle, we have the summer internship. And this is a place to really apply those theories you've learned in the classroom to practice. It's a really important learning process. This isn't just you going off to some random place and fetching coffee for your boss. These are supervised by a preceptor, and the preceptor is someone who is there to help mentor you through the summer. And most of these internships are paid too. And actually, I think that's important. These organizations that hire you need to make sure that they're valuing your contributions to their organizations. Just a few examples here. I actually won't read them all, but you can take a look here at the kind of examples of internship organizations. And it is because we have students who are getting the MHSA degree and the MPH degree, the students are in a wide variety of organizations here, from healthcare delivery organizations all the way to, government organizations. Like I said, we have access to the breadth of the University of Michigan. University of Michigan has 19 schools, colleges, and units, and again, a lot of the popular electives are outside of our department, and it's nice to have some access to that. Just to give you a sense of our alums and what they're doing, our alums are incredibly successful. We have a very large alumni network, and they're doing really, really interesting things, and so it's exciting to be able to tap into that and that expertise. Again, our Alumni Association is one of the oldest and largest organizations of its type. There are over 4,000 plus alumni, really across the United States, North America, and the world. Very successful people at the tops of their organizations. And they're all in all 50 states and over 30 countries. Just to give you a sense of the geographic diversity here, of course, there are a lot of alums in the state of Michigan. We are the University of Michigan, but we have alums really across the nation. And you can see here a lot of places in the upper Midwest, but also in the Northeast, the Southeast, Texas, California, and all up the West Coast, and really across the country. So, depending on, if you want to stay in Michigan, that's fantastic. We have a ton of alums here. But if you want to go to California or Florida or Texas or New Hampshire, those are possibilities for you. And we have a lot of alums there who are, again, very successful. What happens with career outcomes? Well, these are the latest numbers. The School of Public Health posts all this information on this School of Public Health website. So none of this is, super secret. We want to be open and honest about what the career outcomes are. And this is an important thing for you to be thinking about. Again, this is an investment in your career, and you want to be careful about that investment. You want to make sure you're investing in something where you're going to have good career outcomes when you finish this program. So this is just these are just a few slides with some information about some of our career outcomes. We have very successful graduation numbers here in terms of students getting jobs here. This graph is maybe a little misleading. It says employed 76%, but the students in the fellowships, internships, and residence, these are also kind of employed as well, but just a different type of employment. They're getting paid. Don't worry, even in these what these fellowships are, they are paid. So about 20% or so, maybe a little bit more than that, end up in fellowships, and fellowships can be a really great option for many students. Not every student, but it can be a really great learning experience for many students. And then, of course, some students go on to advanced degrees and so forth. So where do students end up? Well, a lot of them, about 50%, end up in hospital systems or healthcare providers, but students end up in a wide variety of places. So they might end up in universities or government organizations. Many students end up going into consulting. That's a popular career path as well. But students go to pharmaceutical, biotech, nonprofit, and so forth, insurance, a lot of different places that students will go. You can see in the upper right-hand corner a variety of different places where students end up. As I mentioned earlier, we have alums across the United States. So you see a few logos here that are specific to the state of Michigan, but there are many here that are across the country, like UCLA or Harvard or Texas, and Centers of Medicare and Medicaid Services. So students are going to a wide variety of places when they graduate. And at the bottom here, we have some average salary information. And so when you graduate, you of course want to get a job, and then you want to get a good paying job. You're taking off several years of your life when you could be working to go to graduate school for a couple of years. So there's a big opportunity cost to attending graduate school, and there's also a financial cost too. The University of Michigan's tuition is not free, unfortunately. So that's an investment you're making, and you want to make sure that the investment you're making is going to pay off. And presumably you want not only, this is kind of the starting salary, and of course our students have really good salary trajectories following that first year as well. So that's really the kind of high level overview of the University of Michigan's Department of Health Management Policy. Hopefully this has been giving you a good sense of what we're all about in terms of our mission, vision, and values, what our curriculum looks like at a high level, and some of the strengths of the department here in terms of what you might get, access to other parts of the university, the alumni network, and career outcomes. With that, I think I'll stop, because I think for these kind of sessions, it's really great to have some time for question and answers. So I'd like to kind of open it up for questions. And but if you want more information too, I got some nice URLs and email addresses for you to reach out to contact us with additional questions should you decide that at the end of this that you have a burning question that you forgot to ask during the session. So anyway, with that, let me stop and open it up for questions. So I guess there are some questions in the, or some comments here from Evan in the chat.
David, there's two folks with their hands raised.
Oh, okay, yeah. Luis?
Hi, thank you. Sorry, I don't have my camera on. I'm currently at work group right now.
No problem.
But I am a senior at Penn State right now, studying health policy administration. And I have a quick question mostly about, I guess, returning back to school, even if it's like a gap year. Do you know if there's a different process behind going directly into the program, or like what's the expectation between the gap year and actually applying for the program itself?
So sorry, if I can, let me know, make sure I'm understanding the question. So you're asking about kind of coming directly into school from undergraduate, or versus working and then going to school? Is that kind of what you're getting at?
Yes, pretty much, yes.
Yeah. And so I will say, we have a wide variety of students coming into the program. We have some students coming in directly out of undergrad. We have some students coming with work experience. And, for some students coming into our program directly out of undergrad can be the right path. But typically you want to make sure you have really strong kind of academics and a strong understanding of what health management policy is, and make sure that this is kind of the right career for you. This is really what you want to do. Oftentimes students with some work experience, though, can be really successful, and having that work experience can be really beneficial as you're coming into the program. It gives you some kind of background to and context to the things you're learning about in the program. You have some real world work experience to as background for all the things that you're learning in the program. So it can be successful for both types of students. Yeah, hopefully that answered your questions. Or is there something else that's more specific?
No, that's perfect. Thank you so much.
Just Dave, I know it's a quick question and quick statement. Mr. Atano, the differentiator when you have classes as a professor, it's easy to notice a direct student or a gap year student versus a work experience student. But I would tell you that it's not easy for you all to distinguish yourselves after the semester is over with grades. So to think that a student coming straight from undergrad, taking the same exam versus a student with a little experience or more, in the end, you all end up in the same place. And what Dr. Hutton showed you earlier, we do really good with graduating students, all types of students, and we believe that the mix is really important. So, and knowing that you're thinking about it, the gap year kind of student, they're still awesome. I think direct students are the most awesome, not because I did it, well, kind of because I did it. But I also think that taking a gap year with the way that things are for a lot of you makes so much sense. And then those of you out here with work experience, you'll end up being one of the leaders in one of the teams that we put you in, but very quickly all students know and you all do really well.
Yeah, Cecilia?
Yeah, hi. Thank you all so much for being here today. I really enjoyed your presentation. My question was, what would you say that students who have graduated, what would they look back on and think they gained the most from the program?
That's a really good question. And that might vary for students. Different students, are going to get different things, of course, out of the program. Some students will say, "Oh, I really enjoyed this class, and I got something out of this class." And that's one of the best things as a professor is after a student graduates, sending you a message saying, "Oh, I really, learned a lot, and I'm really using this that I learned in your class," and that just lights up our day. So that's sometimes that can be one of the things. And we have, I will say, one of our guest lecturers, Joe Horton, he's a hospital CEO. He just finished up class, and I heard wonderful things from our students about, oh, we love Joe's class and the leadership advice he gave us. But I think another thing that a lot of our students get out of the program is really the relationships with each other. And that's one thing I want to mention, you don't want to neglect, is building those relationships with each other in the program. And I think that's one reason our alums are so committed to the program and committed to each other is they have this, love for each other and the program and everything. And so when you're in a program like this, that is an important thing not to neglect, is building those relationships with the other people in the program and that camaraderie. It goes back to that idea about collaboration. When you graduate, you're not totally leaving the University of Michigan. You still have those relationships with us, the faculty, but also each other. And those relationships are really valuable. I mean, it's great to be able to know someone who's a consultant about X, or someone who's in the health insurance industry, or someone who's doing policy work, someone who's a hospital system CEO. It's great to be able to know those people in your future when after you graduate.
Yeah, definitely. Thank you so much.
Maybe I'll just add, our cohorts are usually about, 60 to 70 students. So you're actually in a fairly large cohort, which is good, right? Because you get to meet a lot of other people and sort of build your network while you're in school. You also have typically the cohort above you and then the cohort coming after you, right? So there's an additional like 120, 140 people. So I think that makes a big difference too. I think the other thing is that it's very easy, I think, for students here to take on some leadership, options, right? The student associations that we have and other ways that our students become involved. So even I think students who just come out of undergrad who don't have a lot of professional experience often find it very easy to sort of develop their leadership skills. And I think that's always what I advise my advisees, especially with not a lot of professional experience, is to develop your leadership skills by doing these kind of things outside of the classroom. So that's another thing I think students really look back to and appreciate and know that they can get here.
Yeah, for sure. Thank you so much.
Okay. Actually, before we get to Jenna, I think Astrid asked the question about fellowship opportunities, and we don't. Some of these programs will require a fellowship. We do not require a fellowship, but I think a fellowship can be a great option for students after graduation. So you're here in our program for 2 years, and then if you want a fellowship, you can do the fellowship. We're not going to force that on you, but you can do a fellowship, and our students are very successful at getting into fellowships if that's something that they want to do. For a lot of students, particularly students straight out of undergrad, I think a fellowship can be a fantastic experience. So for students kind of switching industries, a fellowship can be a fantastic experience to kind of give you exposure to a really high performing organization and give you a sense of what they're all about. And the way I think about a fellowship is it's really leadership training within high performing organizations, and they're hiring you because they want to kind of give you exposure to their entire organization, a lot of different parts of it, and they're trying to groom you to be a successful leader within an organization. So a fellowship can be a really great opportunity for the right student. We don't require it, but for those who want to do it, we're happy to kind of help you and encourage you to do that. With that said, let me stop and let Jenna ask her question.
Yeah, hi. I was just wondering if you think your program and curriculum is applicable kind of in an international setting, or if it's more US based, because I'm a Canadian student and would love to study in the United States, but would hope that anything I study would be applicable if I decided to come back home for my career.
So that's a great question. I will say a lot of our program parts of our program are very US centric. I mean, we're in the United States, so we'll talk about the US healthcare system and some of the challenges that we face in the US healthcare system. So there's a lot of that focus, but I think there's a lot for us to learn internationally. And so some classes will, talk about, hey, what about this universal healthcare thing a lot of other countries around the world are doing? What's up with that? How is that useful? How is that valuable? How is that different from the way we operate things here in the United States? There also are several classes on global health that you can choose to take all of them or just some of them. One of which is talking about global health in high income countries. So if you're probably more applicable to Canada. And I will say we have students who are very successful working in Canada after graduation, and students getting internships at sick kids in Toronto or something like that, for example. So students definitely who want to or have successful careers in Canada after graduation.
Thank you.
Mm-hmm. Yeah. And then I think David had a question about the executive program, and I apologize. Yeah,
We tried to answer some of that
we
in
tried
the
to answer
chat.
some of that in the chat. Okay.
Yeah, I mean, mainly the difference is, right, the executive program, usually you have to come in with some professional experience. So it's not a program for someone who comes right out of undergrad. So we have a lot of clinicians, physicians, and other healthcare professionals who often want to move into more of a leadership role. The other difference is that obviously this is a program that where people continue to work full-time and take classes in the evenings and weekends, versus our residential program is a full-time residential program. So students might have like a 10-hour-a-week job, right? But they are not working full-time. So it's a different audience, but also a different way of delivery of the program.
And yeah, we want you to have 5 years of work experience for the executive program. And there is no internship for that because you are working full-time during that program. So that's a little bit different program. You're taking some classes online. You're coming into Ann Arbor 1 or 2 weekends a semester, kind of long weekends, like a Thursday, Friday, Saturday weekend, and taking some classes, kind of full day. And so that's an intense program. I mean, I'm not going to lie. I mean, the students who are in that program are like, wow, this is a lot of work. But it's something you can do while you're working, and 2 years later, you've got the degree. And I will say, those students, I'm really impressed with how they also bond with each other. And it's important to, again, make those connections in a graduate program. And there's a little bit limited exposure to between the residential master's program and the executive program, but there's a little bit of connection there as well. But typically, the executive program students really bond with each other in their cohort. And again, the residential students bond with each other in their cohort. So I guess maybe I'll move next to Josh.
Hi, thank you for putting on this presentation. I really enjoyed it. So as someone who is interested in rural healthcare, do you know off the top of your head if any past students have had internships in more of a rural type setting? Maybe not totally rural, but maybe with like healthcare systems that have community outreach clinics in rural settings?
So that's a good question. And I'm not the right person to ask about this because I can't think of someone off the top of my head. I don't know if Eben or Simona have any.
One more time, which group? Which person?
Rural health internships.
Oh, yes, we have this conversation all the time. Joshua, are you looking at other programs that focus on rural health? Because I know some of them, they have a focus area. I think within our programs, not I can't think about an alum right now directly, but I know many of our alums have led. See, rural health to me is just a small city. I've grew up in a small city, but we do have rural CEOs that are systems, and they go to hospitals to have that strong rural healthcare conversation. You'll get it in some of our cases, but not necessarily. There are some programs that have a focus on rural health. And I know some of those programs, and they are really good and they're great with that focal point. I would say if you pivot and shift, you're going to get the conversation of a rural health hospital, rural health care delivery in our courses ad nauseum, but it may not feel like that specialization for some of the other places, but we do have it. And David or Dr. Hutton, I was thinking of, I know Herzog might not say he's in rural health, but I think, one of the areas where he is, it's kind of rural, and he's rural executive. And there are several other executives who we know who end up in these great places leading these healthcare organizations. So we have a lot of that context.
Yeah, I will say, we don't have necessarily a rural health specialization in our program. So to be fair, that isn't necessarily one of our specializations. But like Evan said, Dr. Hudson said, is, so we certainly can, I think, find rural opportunities for you as an internship. We have a ton of alums with experience in those areas. Michigan itself, the state has a lot of rural areas, especially the Upper Peninsula, for example. And there are many challenges that are faced in those more rural areas as opposed to more urban areas like Detroit. So there are a lot of different challenges, and there are many different solutions. Telemedicine, for example, that might be good, and so you will learn about some of the strategies to deal with that in our program. And I think we can find an internship that is appropriate for someone with an interest in rural health. But to be fair, though, that is not necessarily our our focus in the department.
Awesome. Thank you so much.
Let's see. I think there was, I briefly saw something in a chat about a question from Lydia about something, an accelerated MPH. Excuse me. So we don't have an accelerated MPH. The program is, a 2-year program, both for the residential students and for the executive students. It is possible. We have some dual degree programs where you might get a dual degree with public health, health management policy, and maybe the Ross School of Business, or the Ford School of Public Policy, or engineering, social work, or epidemiology, or some other part of public health. But typically, and we kind of accelerate things with that. That's a 3-year program, and you get 2 degrees in 3 years. So the health management policy part is basically 1.5 years, and then the other part, let's say Ross, is another 1.5 years. So the health management policy part is accelerated slightly, but the entire time you spend at the University of Michigan is actually longer because, again, you're getting 2 degrees. But most people are here for 2 years in the program. If you're interested in that dual degree program, that's another unique thing, or something that's nice about the University of Michigan, is that possibility to get the dual degree. The way that works is you apply to both programs. So you'd apply to health management policy and apply to Ross, or health management policy and the Ford School, something like that. And you could do that now if you want to, or you can spend a year at the University of Michigan and then decide you want to do the dual program and apply once you get here. Cecilia, you had a question?
Yeah, hi. I was also wondering, how flexible are the research programs? I'm from North Carolina, and I'm currently doing research with the UNC School of Medicine. And I was wondering if I could possibly continue, if I was possibly going to continue that at even grad school while pursuing my, master's degree. I was just wondering how flexible the research program was at University of.
Yeah, so I will say our degrees we're talking about here, the MPH and the MHSA degrees, are professional degrees, and so we don't have a research requirement. There's no thesis that you're writing as part of our degree program for the MPH and the MHSA. With that said, of course, the University of Michigan is a major research institution. All the faculty are involved in a lot of scholarly research. We certainly respect and value that. And so if you're interested in research, you certainly can do that. And the faculty, again, we're doing a lot of research, and oftentimes we're, interested in working with students, master's students, and with us on research, or I don't know, if you're interested in continuing doing some research with faculty at UNC, I mean, we're not going to stop you from doing that if that's something that you're interested in. And I think that if you think that'd be something that would contribute to your learning experience and help your career development. If you wanted to do something with University of Michigan researchers, I'm sure we could find a way to connect you either with people in health management policy, or in the School of Medicine, or epidemiology, wherever it is that kind of fits your research interests.
Okay, yeah, that sounds awesome. Thank you so much.
And Ms. Yu, another statement I would also say is, knowing the UNC program, I think it's a really good one. But you are at another R1 institution, in our School of Medicine, Michigan Medicine. I think it's on par with that. So, I would encourage you, if you were here, I'm sure you love your team and you love your research group. I'm sure there's an equivalent here. I'm sure that Dr. Hutton, Dr. Singh, someone else would love to have a really good researcher. And I think as a student, if you're interested in specifically what that group is doing, there may be a connection here. And I think there are other things that you could do and or learn. I think many of our students, I can't think of one that hasn't had a desire to work in research, either with Michigan Medicine or one of our programs, that didn't find that space within a year or so. So just kind of giving you those options. Sometimes we're held to our teams, right? You're doing awesome research there. And like Dr. Hutton said, no issues, no problems, but I also think that you'd find a lot of good synthesis or a lot of good comparisons here with some of the work that's going on.
Yeah, definitely. Thank you so much for saying that. I was looking at the programs and the research labs at the University of Michigan's School of Medicine as well. And I was just hoping that maybe their professors, or even at the even for my MHSA program, hopefully like my professors would be flexible with like research on both ends. But thank you so much.
There's a question chat about financing the degree. So maybe David, if you want to address that.
Sure. Yeah, I mean, look, the University of Michigan's tuition is expensive, and so that's an important thing to consider is how are you going to finance your degree. There are many different ways to do that. One of the ways might be to work part-time, and that could be working at Michigan Medicine, the hospital system, or it could be working with a policy organization like the Center for Healthcare Research and Transformation. So you might work part-time or doing research like Cecilia's been talking about. So that's one way to help get some funds. But oftentimes, students look outside for scholarships. They'll look outside for loans, and then we in the University of Michigan do have a limited scholarship budget, and we'd love to give full rides to everyone, but unfortunately we can't do that. So we have to be judicious about how we spend our small scholarship budget. So that is something we have available to assist students and make sure that we can try to make things easier to attend the University of Michigan. But I would say, the biggest ways that students do their financing is probably through loans and to some extent working part-time. I think Mr. Otano?
Yes, thank you, Ms. Otano. So pretty much it's the same follow-up question to what you just answered, but are there any specific programs that support whether McNair Scholars, like the TRIO program, or anything that helps first-generation students pretty much succeed within the program? I know I'm currently a McNair Scholar here at Penn State, so I'm wondering if there's any of that extension at University of Michigan still offered to graduate students or prospective students in general.
Yeah, so actually, yeah, we're really excited to have McNair students. I don't, Evan, did you have something you wanted to say?
Yeah, no, I'm thinking we know you well. The quick version is we know you well, and when you get here, you do well. So I'll say it that way. And the McNair Scholars Program and some of the other, what you call first gen programs, but some of the other affinity programs here, our students do so well because we're so familiar with them. And it may not look directly like what you're doing in undergrad, but there are so many mentors here who've done that with McNair Scholars. There's so many of us as faculty who work with programs and students who are really keen and want to make sure that they get seen and that they have support structures in place. And so I can count off right now probably 10 students that have been McNair Scholars over the past 5 years, and all of them are doing well and quote unquote killing it where they are right now. And I would say for any of you that have these program components to you, McNair Scholars, some of the other ones you mentioned, the University of Michigan is one of those places that we see you all and we know what to do with you to get the best out of you.
Thanks, and Dr. Ross. And I want to just second that the McNair Scholars that we have had in the program have been really successful, and we've had quite a number of them. Yeah.
Thank you.
See, I know Simona, Dr. Singh, you've been answering a lot of questions in the chat. Are there any things that I've
there is one thing
missed
about
here?
the specific courses for MPH and then sort of for the 2 degrees.
Yeah, maybe as a follow-up, we can send out a link or something like that to the list of courses. But actually, maybe the kind of big picture, we can talk about some of the courses that we're taking, that students take. And they're slightly different from the MHSA degree and the MPH, but broadly speaking, many of the classes are the same because, again, we want to give you that integration of management policy. So the first class you'll take in the first fall semester is a class on just kind of the general U.S. healthcare system. And then you'll also take some classes on kind of management and leadership in organizations, some finance and accounting classes, classes about kind of quality, some classes on broad public health, so epidemiology, environmental health, a little bit of health behavior, health education, so giving you some broader exposure to population health, public health, biostatistics, and so it's important to have some quantitative skills in statistics, biostatistics. You might take a class in some healthcare operations. So my PhD is in industrial engineering operations research. And so I have an affinity for that kind of quantitative analysis to help you with your operations. Let me see what I'm also, I think maybe I mentioned some health policy classes, whether you're interested in policy in the MPH degree or the MHSA, everyone's going to get a little bit of health policy. And depending on if you get the MPH, you'll get a few extra policy classes. It might be looking at program evaluation or cost effectiveness analysis, for example. And kind of as you get into the second year, the end of the second year, there's a capstone course that students take. And that's designed to kind of integrate everything that you've learned throughout the first year and a half, and kind of put that all together in a real world project that you'll be working on. And that real world project might be for a healthcare delivery organization, like a hospital system, or it might be with a policy organization, like the Michigan Department of Health and Human Services. And you'll work on that project in a team and try to synthesize and take a lot of what you've learned in the classroom and apply it to that problem at the end of the second year. Yeah, let's see. Oh yeah, Simona, you just threw that link in there. That's even better than sending up a follow-up email afterwards. So that can be helpful. Yeah, so I think those are some things here too. Oh, so then I guess one other question here or something here is about the programs that we provide. And I guess I've been focusing a lot on our master's degree programs, residential master's programs, and a little bit of the executive program. We also have a PhD program. We typically call that HSOP, Health Care Services, or actually, what I'm blanking on right now, or organizations and policy, and that's our PhD program. And for the right student, that's a fantastic program. So if you are really interested in research and you're interested in getting those really great research skills, and you're interested in a career that relies on those research skills. So you want to be an academic like Dr. Dotson, Dr. Singh, or myself, or you want to go work in a kind of research heavy health policy research shop. So you want to work at RAND, or maybe you want to work at CDC, but be involved in research, things like that. A place where a PhD is really valuable. I think we've got a great program for that. Our students, our graduates who graduate from the HSOP program, the PhD program, are incredibly successful. You know, they're working at some of the top universities around the nation, around the world, and they're working in really great health policy organizations, both in the U.S. and around the world as well. So that in that program, you're taking some of the classes with our master's students, but then really focusing in a lot of the kind of research methodology courses. And if you're interested in the HSOP program, let us know and we'll get you more information about that, the PhD program. And also when you're in that, the PhD program, I would pay special attention to looking at individual faculty and seeing if there are good faculty who are a really good match for your research interests. Because that's a really important thing to find when you're in the master's program. You're taking a lot of classes and you'll be exposed to a lot of different faculty. In the PhD program, you are kind of getting a little more narrow. You will get exposed to a lot of the faculty, but in the end, it's really finding the key core faculty that you want to build that research mentorship relationship with. So it's important to find that when you're thinking about a PhD program. Let's see. Other questions here. Yeah, Dr. Dotson or Singh, am I missing something here?
There are a couple of questions, and maybe you did talk a little bit about it, but it sounds like a few people are also interested in how to frame their applications. And so I put in the chat, when you have your personal statements, focus your personal statements on what you're interested in as far as topics, how you can benefit our program, and really why our program is a differentiator. But I know I love, and everyone here, you get a chance to have Dr. Hutton. I don't want to like push everybody to have one-on-ones, but he's really good at understanding and having that conversation around what your interests are, but being able to convey that potential students in your application. But maybe there are other things that you would suggest for students as they start to prepare their applications.
Yeah, and I think I think there are some great comments in the chat from Dr. Dotson and saying about how to kind of think about your application. The way I think about it is when we're admitting students, we want to make sure that our program is a great fit and that our program is the right fit for you and that you are going to be successful here. And that what you want to get out for your career is a fit with what we are delivering in our program. So, we're looking for things like the academics and good grades because we want to make sure you're successful and you're going to be, successfully completing the courses and passing the courses and everything. But that you've got that kind of competency and skill to be successful. But also we want to make sure that, Michigan health management policy is the right place for you, that you really do want to, go be a policy leader or lead a healthcare delivery organization and that, the University of Michigan is a good place for you, that we're going to be able to deliver the education and skills and contacts and connections and stuff that you need and to be successful in that area. So, we could have a brilliant student, but who wants to be a neuroscientist, our degree isn't the right place for you. You want to be the next Leonardo da Vinci or something like that. Well, our program isn't the right place for you. But if you want to be a hospital CEO, you want to, lead the CDC, you want to, change population health, then maybe our program is the right place for you. I see a comment here from Tanner. Are there any particular people at University of Michigan who work involves alternative payment models and value-based care? Great question, and the answer is 2 thumbs up, yes, a resounding yes. Rich Hirth is a faculty member, for just as an example, in our department, who is looking at different payment models. He has a particular area of expertise looking at chronic disease policy and particularly kidney disease policy, and very well known nationally and internationally for his work in that area. Chronic kidney disease policy is very challenging. It's really, really expensive to provide dialysis care for patients. So it's really important that we manage that properly. These patients are really sick too. So you don't want to screw it up and change the incentives so patients don't get the right care that they need and end up dying. But it's incredibly expensive too. So this is a really tricky area where you have really expensive, but really important high value care. And so Dr. Hirth is working on that policy to make sure that we're not wasting money, but giving patients just the right care with those proper alternative payment models. And then Andy Ryan, as Dr. Singh mentioned too, is doing really interesting work on alternative payment models. And then there's the Value-Based Insurance Design Center with Mark Fendrick, who is affiliated with our department as well. He's one of the leaders, kind of 2 progenitors, if you will, of value-based insurance design, which is part of the Affordable Care Act. The hard work that he's been doing, kind of got into the Affordable Care Act. And so he's just incredibly brilliant and has a lot of really great ideas and perspectives on how we should be thinking about value-based care, and really a strong promoter for value-based care as well.
Tanner here, thank you so much.
Great, yeah. So we just got a few more minutes left here. Let's see, are any other questions that I missed? By the way, let's see, I've been asking a lot of questions or answering a lot of questions here. Yeah, Dr. Singh or Dr. Dotson, anything you guys want to add to? I mean, I feel like I've been monopolizing the conversation a little bit. Anything else you guys want to?
We're triaging here. We're triaging in the background. So you're doing a good job. You're giving us the cover to answer some of the other questions that people have. So I think we're doing a good job.
Okay. Yeah, so any other questions from anyone? Okay, well, if not, I'll wrap it up here. So thank you all for attending. It's been really nice to share with you about what the University of Michigan's Department of Health Management Policy is all about. And really glad we had the opportunity to answer a lot of your questions. So thank you again for coming, and we hope to see your applications. If you have additional questions, feel free to send us an email, and we're happy to answer more specific questions. And I'm sure you will have additional questions as you kind of go through the process over the next few months. So thank you all for attending.
Did we get there? I was just rushing to see if we can make it.
Yeah.
And I was trying to send him the event for tomorrow that Dr. Ryan is putting on.
Oh, okay. Yeah, did we get that?
Yeah, there's
Chip,
a
did you
link.
get that?
Hopefully it works. I sent him one of the links that's there.
I did get that. Thank you so much.
Okay.
I didn't see it in
Yes.
the calendar. Got this meeting instead. So
Okay, well, hopefully this wasn't total waste of, I mean,
no,
I
absolutely.
will say, hopefully we gave you a good overview of what the department's all about. I think the PhD programs, I did focus a lot on, master's outcomes and
Yeah.
so forth. But the PhD, can be, well, we like to brag, I guess, but I mean, I would say, if you really are interested in kind of, health management and policy, our program is incredibly, the students are successful. Dr. Singh is one of the graduates of our program, so she can tell you a lot of good things about it. Dr. Dotson's a graduate master's program, but yeah, the PhD program, I think, the students who graduate from it do really well in this area of health policy.
Yeah.
Yeah,
I'm familiar with some.
it's a great program. But again, I think, what Dr. Hutton said earlier, finding a good fit in terms of, an advisor, a mentor, right, a research area that you're interested in is probably even more important for PhD students and for the master students. So again, as you look at, different programs, so look at the kind of faculty that are in the program, so you can find, a group, ideally a group, or at least one person, right, who you want to work with. I think that's very important. And again, usually PhD programs have, like, at least maybe after COVID, in-person visit days. And so, like, those visits are even more important to really get a feel for the program, because you're going to be spending 4, 5, 6 years in the program versus 2. So
Yeah.
But yeah, reach out. I'm happy to answer questions, or, again, all of us can answer questions, or, move forward your question to someone else who can answer it.
Very good. I appreciate it. Thank you so much.
Okay. Well, thanks. Anything else, guys?
Yeah, if there's any other
Lydia?
questions, feel free to
Lydia,
ask.
Astrid, there's only a few here. I know you're having questions about finances and other things. Either one of you, before we go?
Yeah, so Devin, I would say just send an email to myself here, or
Yeah.
I think we also had there's like SPH admissions or HMP admissions that you read, but just send.
I put all our emails in the chat a little bit further up, but I mean, feel free to reach out to any one of us, because we can always, forward an email to whoever's the right person. We also have a staff member who is a student services specialist, and she can often answer some of the more technical questions that we may not know. So just contact anyone, and we'll be happy to, try to help as much as we can.
All right. Well, thanks everyone, and thanks for coming tonight. Have a great night.